Hello, everyone. Welcome to Simulation Pulse. Today we have a very special guest, Bill Ballo, who has been joining us as a co-host for the past several months here, several years at this point on the Pulse. Is going to give us an update on how things are going at Madison College's really incredible and innovative new XR Center. Although I really can't even say it's new at this point. You guys have been in there
Well,
for a while.
it's
And
two
so now
years.
we get to see the journey that you've gone on, from my perspective, having built, VR software and getting the opportunity to meet Bill at our office here in downtown Madison several years ago. I think it's probably 6, 7 years ago at this point. It was a while ago. And Bill really understood the value of virtual technologies in education from early on, and immediately started using it in really innovative and interesting ways, and is now running the entire like XR center there at Madison College. And we've had Bill on as a guest, several times as a special guest, and obviously, like I said, he's been a co-host. But today we wanted to put a spotlight on the program, see how things are coming along, see if there's any new tips or tricks or insights that you've learned along the way, and anything that you can share with the Acadicus community that'll help other programs make use of VR Sim. So I'll turn it over to you, Bill.
Yeah, absolutely. Thanks. I appreciate it. And, we talked about doing something like this, and sort of highlighting some of the things that Madison College is doing. John, it's been 6 years. It was September of 2019 that you and I first met downtown Madison at your office, and the you had done a little bit of knowledge research prior just to know who I was, but not a ton, because when I got there, we started talking. You started asking me like what kind of things you like and how do you teach and those kind of things. And cardiology was my specialty, and I saw a heart when I was in VR, and boy, that was it. That was it for me. I said, all right, yeah, I can use this tomorrow. And within a month, we were using it in my cardiology class, and it was great. It was fantastic. We got everything going, and my students just thought it was amazing. So I've always been one to teach with weird methodology anyway, and now I don't think of virtual reality as weird. Back then, I did. Back in 2019, I thought, I don't know if I can do this stuff. Like this is not the thing for me. But yeah, it's been great. And so of course here I am in the XR Center. Like the comfy chairs are up front. So that's you'll hear some suggestions from me today on some ways to get engagement, and that's one of them. Is put your comfortable chairs up front, put your uncomfortable stuff in the back. People will gravitate towards the front. The one thing we've got the pub table back here, and I do get a lot of people that'll go to the pub table, but that's only set up for four. So, put your comfortable chairs up front. It's a good way to go. So, um, well, there's a lot going on in the XR Center. We opened officially. Um, our official grand opening was May 4th of 2023. So that was our official grand opening. We were soft open in February because we were doing some stuff. And back then it was three programs. There was EMS, respiratory, and nursing. And we were talking to dental. So technically there was four. We were talking to dental about things that we could do, but we hadn't really gotten anything yet. Today, now only 2 years later, a little more than 2 years later, we are we serve 31 academic programs throughout the college.
That's
Um,
incredible.
I will read off the list because I never remember all of them, so I have to keep the list on my phone. And here we go. It is nursing, EMS, dental, respiratory therapy, CNA, HVAC, vet tech, botany, interior design, architecture, disability resources, Spanish, English is a second language, marketing. We have a 3D art class that's generally open to the public, which didn't go this semester, but probably will next. Electrical engineering, mechanical engineering, academic advancement, career services, women's basketball team, our soccer team, our volleyball team. They all do team building exercises with us here at the XR Center. Meteorology, biotechnology, automotive, chemistry, calculus, intramural sports, and I didn't put down the 31st is has now come back to talk to us a little bit more, is our surgical technology program. So we
Hey,
started talking to
Bill, let
certain,
me interrupt.
yeah,
John, you need to go put a flag and just take that snippet right there, right? And cut it and put it
Yep.
on the front page of the web page. There you go.
uh,
That's right. That's right. Yep.
That was
Success with
impressive, Bill.
XR.
That's awesome.
the
That's
grand list. Um, and if you look at the programs if you look at the academic programs that use Acadicus, it's probably close to half of those that we use Acadicus for. So um, we use, let's see, we got EMS or nursing, EMS, dental, respiratory therapy, CNA, HVAC, vet tech, botany, architecture, marketing, yeah, I like mechanical or electric mechanical engineering. We do some stuff with them in Acadicus. Um, so yeah, so and Surge Tech, we're probably most likely it's going to be stuff that we build with Acadicus. So the vast majority of what we do at the XR Center really is Acadicus. It's our heavy hitter, and it's my go-to anytime I'm doing an outside demonstration. Like if I'm doing a demonstration at Fort Atkinson or something like that. Like we were doing Metal Mania out at Fort Atkinson, but then some of the students that came out there, they were looking at medical. Like and I'm like, I've got this MIG welder simulator in VR that's really neat. But that's not what you want to see. You want to see like what will it be for patient care and childbirth and those kind of things. And so it's always my go-to. And when some of my other things will fail, and it's inevitable, some of the other things will fail. I go right back to a catechist. Like it I can always do something in a catechist that will impress someone enough to get them interested in what we can do in virtual reality. You know, and so I wind up doing a lot of things. I wind up being the instructional designer. I wind up being sort of a technical support. I wind up being support for the simulation. Like I don't have instructors just come in and use the lab and try to figure things out on their own. We looked at that early on. Did not work. Did not work. We would have instructors come in and it wasn't bad, but I was usually here. And what wound up happening was they always wound up kind of coming to me for advice on, well, how should I do this? How should I do that? And one of the things that we always hear from our instructors is support. They just don't have enough support for the things that they want to do. And so now the idea is you come to the XR Center, we're a hub for any of this innovation. Yeah, you may eventually go and fly on your own. Career services, they're out flying on their own. Our School of Academic Advancement, they're out flying on their own, but they always have a place to come back to. They always have a place to come back to, and that's why the XR Center was so important. That was why we built what we built, because I didn't think in the beginning, John and I talked about this a little bit yesterday, but I didn't really think in the beginning that in 2 years I'd be serving 31 programs. I thought in 2 years I'd still be struggling to get programs to come on board and to do this. But luckily I'm not, and I think it has a lot to do with we have a place and we have a person. You know who you can go to, the place that you're going to go to, or I bring out my laptops to you. I do that at the satellite campuses. So, if there's any advice starting off that I have for people is if you're making the investment in VR, make the investment in personnel, make the investment in a person, get a person. And that person doesn't necessarily have to be a nurse or a paramedic. I'm a paramedic by trade, but they don't necessarily have to be that. They just have to be someone who's really interested in virtual reality and who can see it for what it can be. That's really it. That's it. That's because then that person is the person that goes and talks to tech services, talks to networking, talks to, all these different places that you're going to need support from. You're going to need tech services to help you out and to get on board. So you need somebody that can talk with tech services, and take people to lunch. Take people to lunch, sit down with them, talk with them, make friends, get to know who they are, what their interests are, because then you see them in the hallway and they know you, they know what you're talking about, and they know what's going on. So that's my
Yeah,
starting as well.
absolutely. That's
Yeah.
amazing, Bill. Really appreciate you sharing that. And I remember seeing every step of the way. And I remember worrying a little bit that, like, if you know, that there might be a chance that we could build this and students might not come in there, you know, so the faculty might be confused by it. Maybe no one will want it, but that was not the problem. That was not the case at all. There's been an overwhelming amount of interest, and it's been really exciting to see the program grow. And, you know, from my perspective, I live in Madison, so I can go to Madison College and I can meet with you. We had lunch yesterday. We can get together in person. I really wish I had that opportunity with all of our customers, but with Madison College right here in my backyard, I can go in there and see these things firsthand, and I can learn from these instructors, and I can talk to Bill, and I can hear ways that we can be improving the software to better serve the program and content that they need to help, you know, grow those programs. So it's been an incredible opportunity for us to learn a lot, and to kind of have this opportunity to see firsthand the way that the software is being used. One question I wanted to ask, I guess, is kind of probably where you're going next, but how do you measure the success? You know, you've got the number of programs is a really key, you know, key performance indicator. What are some other ways that you measure the success and growth of the program?
Yeah, we do kind of start with return on investment, right? Money's been put into this. How is that money being utilized? And is it being utilized in a good way? You know, like what is that return on investment? So the first thing I show is I show the amount of student hours of operation in here. So if 5 students come in and they're each in headset for an hour, that's 5 hours. That's 5 student hours, right? If one student comes in, they're in a headset for 2 hours. That's 2 student hours. So the first thing I always want to do is show how much we are using it because we are looking at more growth. We're looking now, there's so on the other side of the wall that's actually right in front of me, there's another room that we're kind of eyeing and pointing at, going, hey, we would like to maybe have a pass through into that room. And now the XR Center is 2 areas. Well, how am I going to make upper management see that and understand that this area is so well utilized that expanding to another area is not a bad idea at all. Plus we're going to take away an academic classroom. Now we did a little trade, or we're talking about a little trade of classroom for classroom. We have a classroom upstairs that we don't use as much anymore. But so return on investment, very first thing is track the amount of hours that your students are actually in the headset. Because if you say, well, I did, I was in the XR Center today and the students came in and they were here for 3 hours. You look at it, you go, well, that's not a lot. They were here for 3 hours. Yeah, but I had 15 students. Oh, that's a big difference, right? So track it, track your student hours. The other thing is survey your students. We do a survey of our students. We get their feedback as to, we do a little bit more qualitative. So we get feedback more like, what was your experience? Do you feel that this might have helped your learning? Do you feel that you learned the concepts better because of virtual reality? And then we look at what their outcomes are in their classes. And do we see better retention in their classes? And do we see that students are better able to retain whatever it is we're teaching? So if we're doing birthing and we're using the birthing mannequin, are the students retaining that information as well as they do with the big birthing mannequin, or better? Right? Or is it worse? I can tell you it's not worse. Is it as well? Yeah, it's actually better. Generally, we see that our students will retain that information better, and there's some reasoning and some science around that. Because when the students go into simulation, when they go into simulation with the mannequins and all of that, they still have that feeling that they're in a simulation with a mannequin, right? There's not a full immersion. They're in the same room that they were in yesterday or the day before with a patient who was an asthma patient. And now they're in this room and they're doing this birthing, right? And so the environment around them hasn't really changed. So when you take and you change the environment around them as well as the patient that they're seeing and make that more realistic, you're putting them in a situation that's way closer to what they would get in real life. So that's the other thing that we ask the students as well is like, I always ask, compare for me what you do in simulation that we know, because we already know the benefits of simulation. We didn't know it in the early days of simulation. We said, no, clinicals is much better. But we have found that simulation can absolutely replace some of that clinical experience. And so now my question is, does this meet with what we see in simulation? When you go into sim, how does this feel? And almost every student, I get the feedback of, we like this better. And I go, why? Why do you like this better? What's so much better about virtual reality simulation versus, mannequin simulation? Because you're having to like manipulate these, these handsets. Like, it's not that realistic with the haptics. And they're like, yeah, but we didn't feel we were being stared at. We felt we could relax more and do the things that we were supposed to do as nurses or as, paramedics or as whatever. So that's one of the big feedback pieces that we get is that the students really enjoy it more and they feel that the retention is more. And then we see that retention is better on the other end as well.
That's amazing and definitely consistent with what we hear from a lot of programs. It's like once those students start getting in there and they see that, they're wanting to come in, they're engaged, they're excited about simulation, they're excited about learning about, the birthing simulation. Not something they're always necessarily looking forward to in a traditional lab. And we're not trying to compete with mannequins. We always sort of make a point of that there's certain things you should not be trying to do in VR. If you're doing chest compressions in paramedicine, or if you're trying to, there's fine motor skills. If you're trying to do skin stitching with fine motor skills, there's some things that don't translate very well, but there's other things that do really well. Soft skills, communication, step-by-step learning. And it seems like that's really what you're leaning into in these facilitated learning opportunities where you've got the debriefing space that you're sitting in right now. Could you describe?
Oh, we lost you there, John.
John paused for a moment.
Yeah, well, I think what John was asking was
Mhm.
describing the debriefing area and why this was important. So what we do in all of medical simulation, and we find this even in like botany, right? So in botany simulation, they're going to come out and they're going to do a debrief, much like we do in medical simulation. And so what we were looking for with this is to go from the virtual simulation and then go directly to the debrief area, not to have to go from there all the way back over to another building or to a different room or to whatever. I wanted the instruction to always continue in this one space. Bring the instructors from the virtual world to the real world right here in the XR Center, right?
Mhm.
And make it a place where people actually want to be, where they actually want to come. I have students now who will come to the door and like, hey, can we just come in and hang out? This is a great space. This is a, a cool place to hang out. And then they'll talk to me about virtual reality, and I love it. And so a lot of times they'll just sit there at the pub. I have two that used to come a lot. They haven't been here as much anymore, but they used to come in and they'd sit here at the pub table and they'd have lunch. And then they just ask about VR. What do we do? And they talk about VR. And they were really good at the technical side. So I would listen to them because I'm like, y'all know the technical side maybe a little bit better than I do. So let's listen. Let's learn from each other. And so that's what I wanted this to be. I wanted this to be a learning space. I wanted to feel a little bit like a classroom. We have two 85-inch screens that are right in front of me here. So I wanted it to feel a little bit like a classroom, but I also wanted to, because I'm not a big fan of like PowerPoint, standing up here and lecturing and all of that. I wanted it to be a place where, I as the instructor, I can come sit in the comfortable chair and then we can talk and we can have discussions. And everything in this lab is mobile. Everything. The desks are mobile, the partitions that you see are mobile, the chairs are mobile, everything is mobile so that we can make this a multi-purpose area at any point. We have our intramural sports program coming up. We're actually going to do that down in the gym, but if we had to do it here, we could do it here. I could clear some space out. I can move things around. Everything is mobile. It's not specifically fixed. And I didn't want it to be fixed on one type of simulation. Well, it's mainly for medical simulation. No, I don't wear scrubs or anything like that. I don't want it to be specifically fixed on one type of simulation because, I'd have 5 programs at this point instead of 31. So I think that's the question you were going to ask there, John.
Mhm.
Absolutely. Well, I think the role of the debriefing space is really important, in a VR lab, especially if you're doing healthcare in allied health, you really need that space to reflect on how the simulation went. And traditionally in a sim lab, you'd be still gathered around, the mannequin and you'd be doing the simulation, you do the debriefing in real time. Sometimes there's a breakout, you'll kind of move to a different location, but in XR or VR, everybody's in those individual cubicles and they're kind of doing their own experience, even though once they're in virtual reality, it's a little hard to explain that, but you can still see and hear each other. It's like once you're in there, you're together, but physically they're in each of their own spaces. So once they take those headsets off and you switch over to that reflection, you want to be able to do that in a comfortable space where you can talk to the group together, right? So I love that Madison College has that, and we've recommended that to a lot of other programs and shown this as an example and held that up as a great use case. So I think it's inspired quite a few programs to have a debrief space very similar to what you have there, and it's always works really well. One of the things I wanted to do. We're kind of going through a linear progression, and I'm going to break that chronology and go back to the beginning because I think there was a point that I wanted to make and we missed is that you didn't start off with an XR center, right? So I think a lot of people here could be watching this episode and they could be saying, well, we don't have that kind of budget. We could never do that at my college. But that is not how things started. When we first met, I think there were maybe you had a laptop and one headset, right? And when you taught that in a class, it was you had your own, I think you might have even had to use a personal hardware at some point. I don't know if that's
Yeah.
exactly how it went down, but it was like whatever it takes, right? We want to demonstrate this idea. So you started off with a laptop that you could take around the school and show different people before you started building that momentum, right? Could you talk about what those early days were like getting the program started?
Yeah, we started out with one laptop, and then I had a laptop that I had purchased for myself that I was going to use at home because I wanted to do some stuff at home. And so I bought myself a laptop. Actually, my dad bought me the laptop.
Yeah.
So I got this laptop, excuse me, and and then I got my own headset. I bought my own headset. It was a Rift S. And then I cleared out an area at my house that I could operate within, and that was it. Right. So and then I had one laptop from the college because we weren't sure if this was going to go anywhere or anything like that. And one laptop from the college. So when I would do these things, I would carry 2 laptops with me. I had my backpack on front, and my backpack on my back. And I would walk in with my 2 laptops. And then I would just find an area in there where nobody was going to be. Now it was kind of easy because it was during COVID. So like there were plenty of areas where nobody was going to be. So I would just clear a little area. And really all I needed was about 6.5 feet by 6.5 feet, 7 feet, that kind of stuff. And that's what I would do. I'd clear out a little area and then I would do a quick like how to with the student, like here's how you move around, here's how you do it. And that was it. And then I acted as I was the person that was running the simulation. I was also their partner in virtual reality, and I was helping as their instructor as well because it was EMS that I started with, and it was a cardiac arrest scenario. And one of the key points that we made earlier was like about the things you can do in VR and the things you can't do in VR yet. Haptics are on the way, but what are some of the things that VR is really good for, and some of the things that VR is like it's not so good for. VR is good for the thing that's the hardest to teach, and I hear this from everybody: critical thinking. And they say, "Oh, it's so hard to teach students how to think critically." Well, if you take them out of an environment without any facial, or take them into an environment with no facial cues, no real haptics, they're not like picking up an endotracheal tube and actually feeling it pass through the cords of a mannequin. No, now they have to tell you, why am I doing it? And to me, that's the bigger. That's way, way bigger than can they do the skill? I can teach anybody to do the skill. It's the critical thinking that goes along with it. And so we recognized that really early on. And we bought a third laptop. We were like, okay, this could take off. Now let's say we can get two students in together. And so we get two students in together and then meet. And I would then act as the operator and they would work together as a team. And we saw the power of it and we saw how much they enjoyed it. And when they came out of it, they were like, that was amazing. That was so good. Like we knew we feel like we understood this so much better. And that was the point where we went, okay, that's it. That's it right there. And no, we didn't have an XR Center to begin with. We did a lot of grant funding to get the XR Center built. We've done a lot of grant funding to continue to keep the XR Center open and to do the things we do. And we've done some connecting with simulation, but I've always kind of wanted to keep us out of the simulation world technically. Because we wanted to look at all of the other possibilities as well. So now when we have a program that comes to us and says, hey, we want to do this, we start to look for funding in multiple locations. So the first question is always, how did you get started? And the next question is, where did the money come from? But
Yeah, that's right.
but
Yeah.
getting started was the Wild West, John. It was the Wild
It
West.
was. It was.
It
And I
was
think that's when I met
so
you. It's
fun.
like, and we couldn't have this episode without talking about Carly Brady. Carly, she's been an episode guest in the past and really instrumental in getting the program off the ground and spearheading this initiative. And I remember, meeting with her and talking about, she was recognizing that there were these individuals like yourself that were starting to experiment with these things. And I think Steve Knoll was using it in his marketing program, and he is bringing in his personal headsets, trying to get things going. And, these really excited sort of like early adopter instructors were really trying to like get this thing going. And what happens, and we see this happen with other programs that are coming to us now, they're very much later in their adoption curve of VR, but they've got all these silos now because they let all those programs just kind of grow organically. And now marketing has their own thing, and the architecture program has their own thing, and the nurses have their thing. I just had a meeting with a prospect in Florida that said, well, I need this for my paramedic program. I have no idea what the nurses are doing. I know they do something with VR, but I don't know what it is. And it's like these things can be consolidated, and there's a lot of value in making that investment at a high level at that sort of like meta level at the college. And I think that's what Carly identified early on. And I think the genius in how she went about building this was rallying a lot of different departments, a lot of different instructors, and casting a bigger net and saying, we don't want all these individual silos. If we all work together, we can have something bigger and better, and a specific XR lab location with somebody that can help run these things like what you're doing. And I think that's a challenge for administrators because it's an investment. Like you said, it's a major investment to build that XR lab. You have to build, secure the grant funding, get the administrative approvals. I think there's a really cool story that Carly talks about putting the lead of the program, I think the dean of the program, into a headset to play a golfing game, because she's
Provost.
really into golf. The provost, yeah, the provost. So she really liked golf, and so like, okay, let's have her experience something that's relevant to her, and then she got it and understood how that would be valuable for everything else. So it's this major decision has to be made by someone like, let's build an XR center and let's have multiple programs using it together and consolidate that resource. Yes, it's a bigger investment, but once you have that, the return on the investment starts coming in pretty quickly. And it's a little hard to see that in the beginning, especially when we're on this like emerging new frontier where there aren't a lot of like precedents, and you can't just look at a playbook and say, here's exactly what we do. Although your program makes that a little easier, I think, for programs now. You're in the Wild West and you've got to make it up as you go. And the whole time, I feel like I remember being in those early meetings. I think we were all struggling a little bit with like imposter syndrome, right? Like none of us really
Oh,
know how to do this. We don't know what we're doing. We've never,
yeah.
you know, and so, and that insecurity kind of drives like, what, is anybody going to want this? Is anyone going to use it? What if nobody comes in here? And, every step of the way was trying to like, get through that. But the reward record, you get to see now, right? Like you get to see it when the students take the headset off and the instructors are coming in and teaching in 3D recordings and, all these great things are happening. So that big upfront investment, it's hard to make, but if you do it, it's worth it, I think.
I agree. I agree. And when we started off so we made the investment in the XR Center sort of in the blind, knowing that okay, nursing is going to be big and EMS is going to be big and respiratory therapy looks like it's going to be big, but we don't know who else is coming in. And I even sat when I was so again, this is the other thing. Like I put all of this stuff together, like all of the barriers and all that. Like I did all of that, and then all of the wiring work. That's all me. Like I came in and did all of that. So I was invested in it early, but I remember being in here by myself in February of 2023, thinking, I don't know if this is going to be like, is this really going to go? Are we really going to get a lot of programs in here? Like, who's going to do VR? Is it just going to be medical simulation? Is that it? And if that's it, like, why are they going to want to come here and get rid of their, or not get rid of, but not use their simulator over there in the sim center? Like, and then they're putting all this investment into the sim center. Like, are they really going to want this? Is this really going to happen? And by fall of 2023, I was kicking myself because I was like, okay, whoa, hold on. We were up to like 20 programs at that point. And this is from spring of 23 to fall of 23. And Carly and I went out and talked to a few, we went to a few meetings and stuff like that, talked to a few people to get to rally the troops, so to speak. And we got a lot of like lukewarm response. But it was funny because what would happen is someone in that meeting would go, wow, this is really cool. I love this. This is great. The overall meeting might have been like, well, we don't know. Why do we? But there'd be somebody in there that go, wow, this is really cool. And they would come to me and they go, this is really great. I want to talk more. And that was the key, was finding that person, and going, okay, this person from architecture, this person from, interior design, that kind of stuff. And then anytime they wanted to do something, never saying no. That was hard, but because it meant a ton of work for me. And in the early days, like I didn't know how to handle all of this. I didn't know how to handle all these students coming in and all these people. And like, I didn't know how to do it. So, because remember, I had 3 laptops. Eventually we did expand to 4. We had 4 plus then my laptop. So, we were there, but I just didn't know, so you talk about imposter syndrome, and then people would come to me and ask questions like, well, you're the expert. I'm like, the expert on what? I'm not the expert. Like, I'm just treading water here. So, and a lot of people will feel like that. You will feel like I have no clue what I'm doing. I don't know what I'm doing. But you're doing something. I've said multiple times, like, it doesn't matter where you started. It matters where you are. And if you're further than you were yesterday, that's all that matters. That's all that matters.
Absolutely. Yep.
Just
Well,
be a
yeah.
little.
So absolutely. And to do that, it requires this kind of contextual awareness of knowing where you're at, but also knowing where you want to go. So when you had the laptops, you knew you eventually wanted to get to this sort of permanent installation. But even then, that game of sort of retaining that context and keeping the vision going isn't over yet. Because, I
Oh,
remember, even meeting with Carly and you're already talking about we want, potentially to expand to the adjacent classroom. But even early on, I remember the illustrations that because we had the opportunity to help kind of design and work together with Madison College, which was also a great opportunity. But some of the early designs were like an airport hangar, right? Because the main Truax campus is right next to an airport. So we were using that analogy to make it like, what if the XR Center was a standalone building and it was like a warehouse and we had all this space and we could do freestanding simulation and we drew all these like illustrations of what that would look like. And even though that was like way far fetched, and I don't think anybody really believed we were going to build a whole new building for this at the time, but when you put that out there, it's that moonshot that gets people excited, right? It's that like, like, oh, okay, I can see where this is going. And I remember going through every program in Madison College has a directory of all the programs. Well, line by line, I went through every single program. Which one of these has a hands-on component? And if there's a hands-on component, there's chances are you could do something in virtual reality that will help you, give the students an opportunity to access that, do it over and over again, and get it out of the laboratory setting where you have to be there with expensive equipment, with expensive mannequins or manifold gauges or whatever program it is, and get it into this digital world. Again, anything expensive, dangerous, complicated, or impossible, right? You can do in virtual reality. So there's so many programs that can take advantage of that. And so now you're looking at this bigger vision of maybe the next step is that hangar. Maybe the next step is that bigger space, but always keeping that future vision in mind.
Yeah, and I even bring it further than that too, right? Because a lot of people will think of virtual reality and they'll think of simulation and they'll go, okay, well, I can do sim in this. I can do a simulation. I can use it as a simulator. Yeah, you certainly can, and it's a very powerful way to use it. But another very powerful way to use it is like improve your lectures. Improve your lectures. Dr. Sabella, our veterinarian, one of his big things was I've got these. I've got a cadavers. I've got a cow cadaver and I've got a horse cadaver, and like I can't bring those into my classroom while I'm doing some lecture. So he came in here and he stood in here, and his students all sat out here, and on 285-inch screens. Now you're looking at Dr. Sabella, and he is picking up a horse with one hand and turning it around, and pulling pieces out of a cow and going, yeah, look at that, and then explaining the different parts of the digestive system. I learned so much about cow digestive systems. It's amazing. I didn't know it was that complicated. But going through all of that, and now your students, they come to that lecture and they go, I like this. This is great. Why isn't so and so doing this? And so I think of it too. Then any program that has a hands-on component, I completely agree. But any program that has a critical thinking component, because it is invaluable for critical thinking. It is amazing to get people in there and to really, if you really want to explain a concept and how to really think about a concept, virtual reality is a great way to do it. And you can scale it up. You can, some people will say, well, I have 36 students. How do I do it? Well, we break it up in groups of 12. We break it up in groups of 12. I can fit 12 people in here. We break it up and do that, or we'll break it up into other groups, or we'll make it so that they're doing an offline assignment, and then they're doing or out of headset assignment, and then they're doing an in the headset assignment. So and that's where the instructional design component comes in too. Like, get your instructional designers into it. Get your instructional designers interested. I'm lucky in the sense that I'm able to help faculty do instructional design, but get those people involved as well. Get as many people involved as you can that are interested in it, but have that one central resource that everybody's going to go to. I think John paused again.
No.
So. Oh, there he is. He's good.
I'm back. Okay.
Back.
I think I heard almost everything you said. That's great. I'll have to edit this part out, unfortunately.
No
That was so good. So good. Thanks, Bill. I appreciate that. Yeah, my internet is unstable. I decided to start syncing a Google Drive this morning, and I think it's taking up all my upload bandwidth, unfortunately. I should have stopped that. I paused it, but yeah, it's too late. So my apologies for that. But yeah, that was great. Rick, do you have any questions for Bill?
I think the thing I wonder, Bill, is that do you now foresee kind of that next step? John talked about, hey, being able to envision the airport hangar. But do you and the other folks at the college, have you talked about, okay, we've gotten all these programs on board and we're doing all this neat stuff. Where do you see that next step or where you're going?
Sure. Well, I think expanding is on the horizon for us.
You got your eyes on that next door room, right?
Yeah. And there's some tech problems in that room with some of the TVs and stuff like that. So I'm like, listen, we'll trade you rooms. I'll take this room that has these tech problems because we're going to redo most of it anyway. So, I'll take this room that has the tech problems and we'll get that off of your hands. So tech service is like, this is so great. Again, this is how you get people involved. Yeah, so I do see that as the expansion. The one thing that's gonna have to happen if we're going to expand into the next room, if we're going to expand throughout the college, those kind of things, we're going to need personnel. We're going to need personnel. I am one person, and so we're going to need another person to come in and start running some of these. And maybe we split it up in terms of like, here's our medical simulation side. We're going to do that, and here's our everything else, or whatever it may be. Because what I really want to do is I want to go out to more and more of these faculty meetings. I want to go more and more of these department meetings, and I want to start pitching more virtual reality. Like, how can we bring more of this into your classroom? And not just, how can we get you to come to the XR Center? How can we come to you? How can we incorporate this in your classroom where you sit right now? And so we're looking for ways to do that as well. I there's all kinds of ways to do it. If people ever want to talk about that, like, how do you incorporate this into your lectures? That was where I started. So I see more theory class, more of that added in, continuing obviously using it for simulation. But look, we've got these smartphones here, okay? And we've got AI, and we've got all of this stuff that we as instructors are fighting against to keep the students interested, to keep the students engaged. And if you're standing there and you're clicking through a PowerPoint and reading off the PowerPoint, your students are done. They're not engaged anymore. If you're doing group work, you're on the way. You're on the way. If you're doing group work, that's great. That you're sort of helping the students to learn. Active learning, that's great. But we're even kind of getting past that now. Like, active learning is cool and doing group work is great, but you're even starting to get past that now to where you've got to bring more and more technology into your classroom. You cannot be afraid to have the smartphone in your classroom, or the AI in your classroom, with limitations. If anybody ever wants to talk about AI, you can contact me on that one too. John and I had a great conversation yesterday about it. Um, but um, but but then you have to be willing to bring virtual reality into your classroom, and your students want to learn from you. They don't want to learn from some computer program. They want to learn from you. You are the expert. And so you bring something like this into your classroom, and you have an asset that really makes your lecture impactful. Your students will remember it. They'll walk out of there and they'll remember everything you said. I had a cool experience. Sorry, I know I'm like blathering on and on, but I was down in the cafeteria a couple weeks back, and I was walking through the cafeteria to go get my food, and somebody comes up, Mr. Ballo, and I'm like, oh no, what did I do? And it was one of my former students, and they came up and we started talking. I'm like, hey, how's things going? And I'm like, wait a minute, when did you graduate? You graduated, and they're like 7 years ago. It's been 7 years. Like, that's even pre VR for me. Like, okay, so how are things? Man, it's going great. And you know what? I remember about this one lecture that you gave about the sinoatrial node in the heart, and how you talked about your wife and how she used to row crew at the University of Tampa, and she was a coxswain. She wasn't a rower. And that was the S. And I'm like, that all I did with that little, I made a really cool story. I connected it to something they needed to know about, and that student remembers this like random story, right? Well, that's all you're doing in VR. You're storytelling. So, but you're storytelling in 3D. So I want more storytelling. I want more instructors to come in and feel like they can do some storytelling. They can make videos, or whatever it may be. I want to expand in that way. I want to see more of it used in your lecture classes, and I want to see your students going out of that lecture class talking to each other, going, "Can you believe that? That was amazing! Did you see that was so cool? What a great lecture!" Rather than, "Oh boy, we got to come here tomorrow." Right?
Yeah.
I agree with you, and I know for the three of us, it's not so much of an issue, but I look forward to the day too, when, we've kind of migrated to this point where we all have a laptop and a mouse and a keyboard on our desk. But for, the three of us, we also have this 3D headset connected. Like mine is here every day, and I don't think twice now about, oh, I'm going to put this on to do this thing now.
Yep.
Right? It just becomes an extension of the work I do and how I do it. And you're right. I think, somehow we have to push this technology down to the desktop, to the, right to the desk
Yeah.
of the instructors. And I do believe eventually, right, we're seeing this miniaturization continue where eventually, right, students are going to come in
Yeah.
with smart glasses or visors or things like that and get this enriched, enhanced learning capability.
Yeah,
So,
imagine a student emails you and goes, I'm really having a problem. I'm really confused about this. You were talking about tetralogy of Fallot, and I'm really having a hard time understanding tetralogy of Fallot. And maybe you've already created a video for it, and you
mhm,
send them that video. It's a 360 video, and they put their headset on and they go and they watch that video.
mhm,
Or, you say, hey, I can help you with that. I'm in my office hours right now. Why don't you come in here? I'll meet you in,
yep,
X program,
yep,
and we'll go over tetralogy real quick. Yeah, you're having a tough time with it. I completely understand. Let me go in. I got this heart. I'll show you. We'll explain it. And that's the power. That's the real power.
yeah, that's,
Yeah.
and we're really there. I mean, we can do a lot of the stuff that you're describing, right?
Yep.
Um,
Yep.
you and
I've
I
done
did
it.
it just the other day. You had messaged me, said,
We
hey,
did.
can we
We
look at
did.
something real quick? I said, yeah, I happen to be sitting here. Sure.
It's
Threw
crazy.
my headset on. We were right in the room.
It was like the best timing ever. I was,
It was
and I
great.
was, and this is another thing, okay, for people that are like, have some fear of VR, or like, I don't know if I can do this or whatever. I'm going to mess it all up. Look, I've been doing it now for 6 years, okay, and I even taught a small micro lesson on exactly what I needed to contact Rick on, okay, and I was just like, I cannot get this patient to connect to this bed. It was killing me, guys. I'm like, they're supposed to just socket to the bed. Why aren't they socketing to the bed? And so I'm like, I'm losing it. And I finally just said, I'm going to contact Rick. I wonder if he could hop in with me real quick here. And so I contacted Rick, and he goes, yeah, I'll be in a minute. I was like, okay, cool. So I'm in there working, and Rick comes in, hey, Bill, what's going on? I'm like, I can't get this mannequin to socket to this bed. And he's like, yeah, so you have to just turn the bed on. You don't have to bring a bed in. You just have to click the button to turn the bed on. And I'm like, and I taught that lesson, man. So don't
Well,
be
and it was
afraid.
after I had done the same thing about a half a dozen times
Me
myself.
too.
Yeah.
Right.
Yep.
Where we just go, you get so like into, oh, I'm just going to grab this, stick it here, and then I'm going to put this patient here. And why is the bed not going up and down? And why is the bed, what is going on? And Rick just goes, yeah, you got to connect it this way. And I was like, oh. And another cool thing happened in that, and this is actually a good story too. The power went out at the college. So Rick and I are right in the middle of this, and he's explaining it to me, and all of a sudden, boom, the power all goes out at the college. And I was like, oh no. And then it came back on. And so I was like, well, I'll just get back in headset. Well, then things were messed up, right? And so I was just like, okay, well, I'll just go in non-VR mode. I'll go in viewer mode, and he can show me what he's talking about. Your student doesn't even have to come in a VR headset. Okay. I was the student. Rick was the teacher. I just joined in non-VR mode, and Rick goes, yeah, here, remember, you just click the button. I'm like, oh, yeah, that's, yep. Mm-hmm. And he goes, hey, is there anything else that I need to move around? And I was like, I'm good for now. I'll fix it later on tonight. So, but that, like, your student doesn't even necessarily have to come in a headset. You could meet with your student via WebEx, just like we're doing now. There's an Acadicam. You put the Acadicam in there, and then you just move the camera around wherever you need to show your student something. Like, and that to me was perfect. That was what I was doing during the pandemic when we couldn't meet, we couldn't be together. So we were doing, and again, it's all about, in those particular cases, it was all about the critical thinking. And that's what it was with Rick and I yesterday. It was, okay, I wasn't using my critical thinking skills. I was, focused on the just the pull and push skill. And then the critical thinking was like, oh yeah, right. And that's the hardest skill to teach. That's the hardest skill to teach, always has been, always will be. You know? So yeah, and that
Yeah,
was great too. Like I just contacted Rick. I'm like, hey, I'm having a problem. Can you help me out? Oh yeah.
right
Rick
there.
pops his headset on and we're off.
Hundreds of miles apart, and you're able to jump into the same environment together. And I think that's the last thing I wanted to touch on, is that idea of the geographic kind of irrelevance at this point. You can be anywhere. We see the published research at UW-Madison is doing, teaching clinicians in rural Vietnam across thousands of miles. They're able to stand face to face. But, on a smaller scale, at a college like Madison College, you've got multiple locations, right? So you've got several different satellite campuses. And so you've got the XR Center at the Truax location here in Madison, but you've also got these other hubs. So as we, go about constantly trying to raise awareness of what Acadicus can do, we're always looking for these perfect fit customers, the customers that are going to really be able to make a great use and see the most return on their investment. And whenever I talk to a college that has multiple locations, I know that that's going to be a selling point, because now, especially, we've been talking about like the birthing mannequins, these things can weigh 250, 300 pounds. We talk to instructors all the time, and I've gotten this kind of feedback from a lot of different programs where they're having to like, I've got to have my husband haul this mannequin. He's got to get it into my Cherokee, and then I've got to drive 4 hours, and I do a simulation for 2 people. I put it back in the Cherokee. I drive home. I'm not home until midnight, and there's a lot that goes into that, and it's not just colleges, but also medical centers have lots of different satellite locations, and there's a lot of training that needs to happen. And a lot of times the training resources are all centralized around a hub. So how do you perforate boundary? And
Yeah.
Yep.
Yeah. John kind of paused again, but I get the idea of his
Yeah,
question.
absolutely.
Yeah.
Yeah.
And that is the power. That is one of the big powers of VR. Rick, you're in Maryland, right?
Maryland. Yep.
And I'm in Wisconsin. And then, we even had a case where Carly was going over to Denmark. She decided, hey, I'm going to take a laptop and a headset with me over to Denmark, and then we'll set it up over there. And then we'll just do like a little tutorial with the instructors in Denmark, and let's show them what we do. And I was like, yeah, sure. So it was like 5 o'clock. I guess it was like 4:30 in Denmark. It was 8 in the morning, over here. I was at my house. I wasn't even in the XR Center. I was at my house, and I was teaching an instructor about wound care in Denmark. So the instructor was in Denmark. I'm over here at my house, and I'm teaching this instructor about wound care, and how we do that in virtual reality. And it was amazing. It was really powerful. So you can leverage the intelligence and the knowledge of people that aren't right there. And that's a money saving too. Because if you think about, like, if you're going to have somebody come out and be a guest speaker, you're going to pay for their flight, you're going to pay for food, you're going to pay for lodging, you're going to pay for like all of that kind of stuff. Well, you can have them do that guest speaking in virtual reality. So that's another, like, where are we going next? That's another.
Yeah, that one, I can't believe it's not actually created more interest yet. I attend a meeting every Friday morning. I did it this morning, of VR workers, professionals from around the world. And my wife has filmed me from, when I didn't know it while I was doing it. The sense of presence. I mean, I'm turning and talking to people and shaking my head. I'm in this room by myself. But when I go to that meeting, it's like I'm sitting there with 16 other people. And we have people from Africa and Europe and South America and Canada. And, we're all just sitting there chatting like we're in the same room. I mean, it's so powerful.
Yeah.
It is really incredible. So I agree with you. I think that's, a nut that's yet to been cracked. But
Yeah.
again, it is there and it works. And I've been in, of course, we all have, where you're in a class with 10 other folks,
Yeah.
right? I'm helping this organization in Florida now, and they're in there with pre-med students and a physician, and they're broadcasting to another campus. I
Yep.
mean, it's just sometimes like, wow. I mean, just wild. What we're actually capable of doing.
Yep. Amazing. It's totally amazing. It is.
Y- Yeah, I mean, just the parting thought, if I can say so without freezing up, my apologies for my internet connection today. But, we were talking about these different scales, right? So we've got the individual using it. Then we talked about, well, what about a department using it? What about multiple department using it? What about the whole college? But in Wisconsin, we actually have a Wisconsin Technical Colleges Consortium that has a statewide initiative now that's standardizing around a contract for people to be able to get into easily onboard into virtual simulation. And now we're seeing different programs coordinating across the state. And we've got a few weeks from now, we're going to have Chippewa Valley Technical College. They built a dental scenario. I know, Bill, you've already built a dental scenario. Again, there's this cross collaboration where you're going to be able to share ideas and talk about different programs. And we've had different instructors from different colleges in the state teaching each other's programs because they're specialized in different things. And why don't you're an expert in cardiology? Why don't you come in and talk to my students, and I'll talk to your students about this thing. It's becoming geography is becoming less and less of a limiter in that way. And I think that's a pretty exciting future for VR simulation for sure.
Yeah. Yeah. I built, so I took some of the ideas from Chippewa Valley and then just added my own flair to it. It was like, well, I'm going to have the patient go into cardiac arrest, and then they're going to have to actually pull him out of the chair and, all that. And so like, yeah, we just put a little extra flair on it. And then, we tell them, hey, it was really great. Thank you so much. And here's what we did. And we're doing a lot of exchange in that way as well. And knowledge exchange, which I think is wonderful. I don't think you can beat it.
Yeah, absolutely. And the more programs that join in a state program like that, the richer it becomes for everybody, because the resources that one school is investing and creating is shared with everybody else. And likewise, we're seeing, across even bigger spans of, where we've got pediatric intensivists that are teaching things at other colleges and it's just a tremendous network. It gets simulation out of the basement, right? In a lot of hospitals, a lot of schools, it's sim lab is somewhere in the corner or somewhere off to the side, but now it puts it front row and center, makes it very accessible across a lot of different programs. And yeah, it's an exciting opportunity for the future for sure. But we're at the top of the hour. I just want to be mindful of everybody's time. I really appreciate you joining us, Bill. Thank you,
Absolutely.
Rick, our customer experience specialist. I realize I didn't introduce you at the beginning, but I do every week, so everybody knows who Rick is. But Rick is here, and yeah, definitely reach out. Again, we're going to have another episode in the future coming up real soon with Chippewa Valley Technical College. We're going to also have Dr. Sleeman at DuPont Children's Hospital. If we can get him to come back in, there's another layer of a project that they're building. They've been a repeated guest on the Pulse, but they've got a new exciting initiative coming up, and I'm hoping we can get them to talk about that as well. So we'll have a lot more to come. But thanks for joining today, and have a great weekend, and we'll see you next Friday.
Have a good weekend, guys.
Good to see you all.
Yep.